Hello everyone, I'm Agata Mészáros, and this is a video about the Nanny State debate on the Crammed bus ride by the channel Crazy for Public Health. The other day I had the unluck to be on a very crammed bus ride for more than an hour, approximately an hour. To make matters worse, there was no window on the bus, and it was a very hot afternoon, and the bus was standing in a traffic jam. So it should have been a 20-minute bus ride, but it turned out to be an hour ride. When not standing in the traffic jam, it was a ride with steep turns, and many of us did not have access to the handrail. There was even a dog by my legs without a muzzle, and I was quite worried what would happen when the dog gets too stressed out, understandably, and does something risky. Luckily, she was a good girl. But I said that this is going to be about the nanny state. How is it connected to the nanny state? The nanny state debate is about the state, the government, or a public body that creates a regulation which makes life safer, healthier for all people, but takes away some of their free will. An example can be safety belts, which are mostly accepted, and sugar taxes or mandatory vaccinations, which are less accepted. The nanny state debate means that people often debate that their free will should be taken away by someone else to save their health, to prevent a health risk. An early use of the term nanny state comes from a conservative British member of parliament, Ian MacLeod, who referred to the nanny state in a newspaper in 1965. Okay, but I said that it was a crammed bus ride, and that's how I connected it because I believe that in this bus ride, the bus driver was the nanny state. The bus driver wanted to limit the passengers' freedom to prevent something bad, the cramped hot bus ride. He told the people that they should not enter the bus because it is full, but people did not listen and they crammed inside. Funnily, when the people in the bus faced their fate, that it's really hot, that it's standing in a traffic jam, they asked the driver to stop and let them exit the bus. They would rather walk, but it was too late because between two stops, the driver was not allowed to let us out. As in real life, when someone suffers from the consequences of their own health choices, like eating too much sugar or not wearing a seatbelt, they would like to have the good outcome, being healthy, feeling good, but it is usually too late. So, one thing is the regulation, but the other is the enforcement. A regulation is only as strong as it can be enforced. The bus driver had a reasonable regulation do not enter the bus when it is full, but he was not able to enforce it. Another time, another bus driver said the same the bus is full, we should not enter, another comes soon. This other bus driver somehow was able to enforce the regulation. I think probably because he did not open the back doors, only the front door, and was really firm. And even though we were not happy for waiting half an hour for the next bus, maybe it was better than standing in a crammed bus, which is not only unpleasant but also can be unsafe. Another thing which comes up here is information asymmetry. We people on the bus only realized during the ride that there is a road construction, therefore a traffic jam, so the ride takes 3 times as long. We only realized there that there are really tight turns on the road and maybe we do not have access to a handrail. We only realized there that there are no windows to open and there is no air conditioning. And also that we cannot get off the bus anytime we would like to get off the bus. So the bus driver representing the nanny state, its researchers, policymaker bodies, knew it would be best to communicate the risks and to tell people that you should not get out. But it's not always realistic to communicate these risks to people. There were more than 50 people, often from different countries, because there were a lot of tourists there. They would not understand it. He just tried to be the nanny and tell us not to get on the bus. So it was not realistic for him to communicate all the risks and let us decide for ourselves. And the same way, it is not always realistic for the state, the policymakers, the researchers to communicate every single health risk and the prevention or general health regulations. So this information asymmetry, as the same it was true with the bus driver, it is the same with the policymakers and the people in a country. But as a summary, I think do not enter the bus when it is full and the driver says so. This is my summary for this whole thing. Maybe you will look at the nanny state and the nanny state debate and health regulations a little bit differently after this video. Please like and subscribe for more videos to my channel, Crazy for Public Health. Make the healthy choice an easy choice. Bye!